Hello everybody and welcome to the Tuesday edition of Video Clips. And first of all, just to clarify something, this is not a cigarette. Some of you asked. It's not. This is a very small pencil because being a not wasteful person, I'll use this pencil until there's like nothing left of it. So it's a very small pencil, not a cigarette, just to be clear. All right, just a couple of announcements, and then I've got some really interesting stuff to share with you this week. Diet Fiction, the film and the book, will be out soon, and the course actually starts today. Not too late to get registered. We do record these classes, so if you see this and you're inspired and you missed the first class, you can listen to the recording and join us for classes 2, 3, and 4. New member benefit, and if you're a member of Wellness Farm Health, you want to take advantage of this. 6 conversations with Pam sessions each year. All you have to do is call and make a reservation. I do 18 of them a year. We have the schedule posted for the rest of this year, calendar year 2018. On August 31st, all of our package offers expire until fall, actually like in November. So, food over medicine coaching, diet, lifestyle intervention course, education courses like Cancer 101. We have, I think, 13 or 14 of them now, all available in packages with some really attractive offers. And then conference tickets also go up on August 31st. So go to our website at wellnessfarmhealth.com and check out all of this stuff. And if you have some interest or you're interested in talking about career in particular, send me an email at pampopper@msn.com. A couple of other things that I'll mention to you is our next dinner in Columbus is on the 20th of September, and Dr. Peter Bregan is going to be our special guest at that dinner. He's coming in town to film lectures for his new course, The Heart of Being Helpful. So if you live in the Columbus area and you want to come join us for dinner, it's free. Every month we do one here. And then if you want to spend the weekend with Dr. Bregan, 10, 12 people in the room with Dr. Bregan is a magical thing. Lots of people would love to have that opportunity. You might want to inquire about that. And if you can't come to our dinners in Columbus, we can't feed you if you live someplace else, but we can let you join in the discussion. So if you'd like to participate in one of our health discussions as an intro free, let me know and I can send you details. But 45-minute discussion at the end of which you'll know a lot about health that you don't know now, and it's facilitated by our nurse, Mary Marshall. So with that said, I want to talk about attention deficit hyperactivity disorder. And this just will blow your mind. Well, I guess we should be all over the mind-blowing part of this by now, but the FDA has just approved a new form of methylphenidate, or Ritalin, for hyperactive children that's to be taken before bedtime in order to ensure that the child is medicated on awakening and will not cause disruption to the morning routine. It's called Jornay PM. Kids 6 and older can take it between 6:30 and 9:30 p.m. with adjustments in the timing of the drug made in order to make sure that the child is fully drugged in the morning. The drug works based on a proprietary technology that involves coatings that delay release. So the first coating delays release for about 10 hours so that when the little person gets out of bed, fully drugged. And then the second coating controls the release of the drug throughout the day. If you're just thinking this cannot be true, that's sort of what I thought when I read this. The next best is yet to come here. It was approved after 2 phase 3 randomized double-blind placebo-controlled studies that included 278 children between the ages of 6 and 12. In the first trial, which included 117 children, there was a 5.9% difference in ADHD symptoms between the kids taking the drug and those taking a placebo. The efficacy endpoints were measurements of ADHD behaviors in the classroom and the parents' evaluation of morning ADHD behavior. This trial lasted for all of 6 weeks. In the second clinical trial, which lasted for only 3 weeks, there was a 7.1% difference between the drug and placebo groups based on measurements of behavior both in the early morning before school and throughout the day. Now, an obvious problem is that children don't take these drugs for 3 to 6 weeks. They take them for years at a time. So I think it's terrible that these trials are so short. And the side effects are extremely concerning. The label carries a black box warning stating that there's a high potential for abuse and dependence. Side effects include serious cardiovascular reactions, blood pressure and heart rate increases, psychotic or manic symptoms, peripheral vasculopathy, including Raynaud's syndrome, long-term suppression of growth, decrease in appetite, weight loss, nausea, abdominal pain, dyspepsia, dry mouth, vomiting, insomnia, anxiety, restlessness, agitation, irritability, dizziness, vertigo, tremor, blurred vision, tachycardia, hyperhidrosis, and pyrexia. All of this for a 5.9 to 7.1% difference in ADHD symptoms. Randy Sally, medical doctor who's chief medical officer of Ironshore, the maker of the drug, said in a news release that this new drug will cause doctors to think differently about ADHD from now on. You would think that the answer to this would be doctors would think, I will never give this drug to a kid who has behavior problems, but that's not the way things work. He went on to say, quote, many parents of children with ADHD note that the early morning routine is often one of the most chaotic times of the day. The idea of dosing the medication the night before was our moonshot solution, he described it, to meeting this need. The approval of Jornay PM is a welcome treatment option for healthcare providers, patients, and their caregivers. I mean, this just goes beyond when you think it can't get any worse, it does. Now, while the FDA is approving new medications for the treatment of ADHD, the National Poison Data System reports that 156,365 calls were made to regional poison control centers regarding ADHD medications between the years 2000 and 2014. Most of the reports, or 76%, were for children 12 years old or younger, and methylphenidate and amphetamines accounted for just over 91% of the calls. In adolescents between the ages of 13 and 19, attempted suicide, abuse, and misuse accounted for over half of all episodes. For all ages, 81.9% of episodes were classified as unintentional, 41.6% were a result of inappropriate doses, 6.2% were admitted to a hospital, and there were 3 deaths. The researchers reported that increasing rates of reports is consistent with increases in the diagnosis of ADHD and then corresponding increases in the dispensing of medication to these kids. I really think it's time for the drugging of children to stop. While drugged children appear to be more compliant in the short term, drugging does not lead to better long-term health outcomes. The National Institute of Mental Health has concluded that, quote, this is a direct quote, the long-term efficacy of stimulant medication has not been demonstrated for any domain of child functioning, end of quote. In fact, the drugs make the children worse in the long term. And I'm going to give you an example, and I think a lot of people who swear by these drugs and think that their kids are better off taking them, listen carefully. The multimodal treatment study of children with ADHD, referred to as MTA, was conducted by the National Institute of Mental Health, NIMH, involved 579 children who were randomized to various treatments, including stimulant drugs. At 14 months, the researchers reported that the drugs were better than behavioral therapy for reducing symptoms of ADHD. These early results from MTA are often relied on by doctors who recommend the drugs and have been publicized by drug companies, mental health agencies, and the psychiatric profession. The part that a lot of people don't know about is the MTA study did not end at 14 months. Researchers continued to follow the children, and during the next phase, they were not required to stick with necessarily the treatment program that they were assigned to. At the end of 3 years, researchers reported that medication was no longer superior and in fact was a marker for deterioration. Medicated kids showed stunted growth, an average of 1 inch shorter than their peers and weighing 6 pounds less, and also had higher delinquency scores than their non-medicated counterparts. The 6-year results were even worse than that. Ongoing medication resulted in increased hyperactivity, impulsivity, and oppositional defiant disorder symptoms, along with overall greater functional impairment. Kids who did not take medication, on the other hand, were much better off and also less likely to be depressed or anxious. This study is one of many showing that in the long term, and this is true with a lot of psychiatric drugs, in the short term they show that they're shown to be better than not drugging, for example, or than placebo. But the longer the study goes on, the worse the outcomes get in comparison. So children who take drugs in the short term, they seem like they're more compliant. In the long term, everything gets worse. I think there are a couple of dozen articles on this topic in the Health Briefs Library that you might want to check out. This situation is not easy to change, as you might imagine, and one of the reasons is that the false idea that chemical imbalances in the brain cause psychological issues or behavioral issues like ADHD is so ingrained. I mean, it is a belief system. There's no factual basis for it, but it's a belief system that goes so deep that it's going to be very hard to change. In order for things to change, hundreds of thousands of health professionals are going to have to admit that they're wrong, as well as tens of millions of parents, school administrators, teachers, and counselors who have to admit that they're wrong about this issue. And the drug companies and psychiatry professions would be forced to give up billions of dollars in revenue, which they're not going to do that without a big fight, in my opinion. The government has admitted that the chemical imbalance theory is wrong, as is evidenced by the statement that I read from the NIMH, but they don't do anything about the situation. Our government is so toothless to take care of or advocate on behalf of people. It's just it's despicable. So really, the only hope that we have of saving children from a life of further psychological deterioration and failure is for people like you and I to continue talking about this, in spite of some of the nasty responses and hate mail and threats that we receive in response to doing it. And we'll just hope that at some point in time, the number of people who understand this gets to a critical point where things start to shift. Malcolm Gladwell called it the tipping point, wrote a book about it. That's when something is well known by enough people that it reaches a tipping point. It just kind of takes off like wildfire. And my gosh, do we need for that to happen in so many different aspects of medicine. So kids don't have a chemical imbalance in the brain. They have psychological and behavioral problems, and they're fixable without drugs. And by the way, back to what I said earlier, spending the weekend with Peter Bregan, one of the things that you can hear about is how he helps children get better without drugs. He's never prescribed drugs in his over 50 years of practice as a psychiatrist, to children or adults for that matter. So that's all for today. I'll be back to you on Thursday with more news, but before I sign off, I'll remind you, hit subscribe. If you're not a subscriber, click on subscribe. Let's grow our subscriber base, and as soon as we get to 25,000 subscribers, we're going to have a drawing for a $200 gift certificate, and then every time we reach another benchmark, we're going to have higher and higher numbers on the gift certificate. So let's get that done, because you could be a winner. And if you click on the little bell, you can be reminded or notified when new videos are posted, which we do every week. And once again, if you're interested in any of the cool stuff that I mentioned, my email address is pampopper@msn.com. I always answer my emails personally. If you want to talk about some of the things that we're doing here and how they could help you to start a career, change your career, help other people, be busy in the community, we have so many things going on here. I promise I can find ways for you to be useful in this area, and we do need a whole lot of people to be useful if we're going to solve these great big problems. All right, pass this on to anybody who you think might enjoy watching it, and I'll be back to you on Thursday with more news.